Hi, everyone. We're just letting a few more people stream in and we'll get started in a few seconds. Okay, we're going to go ahead and get started as people are still coming in. Hi, everyone. My name is Nikki Banke. I am with the Water Institute at UNC, and welcome to day 3 of the Water and Health Conference at UNC. Really glad you're all joining us today for these verbal presentations. Before we get started, I just have a couple of technical instructions. For those of you who have seen a verbal presentation today or yesterday, you'll recognize this, but just in case. So this session is being recorded for folks who could not attend this live session. Everyone but the verbal presenters has been muted. And please note that all questions that you might have for the speakers should be posted in the Pathable chat box through the conference platform, not through Zoom. And I'll relay your questions to the speakers as they come. And yeah, without further ado, we're going to go ahead and get started with our first presenter, who is Professor Daniele Lantagne from Tufts University. Go ahead and share your screen, Danielle.
Good afternoon, good morning, everybody. I'm sharing my screen. Can you hear me? And is it all good?
Yep, looks great.
Okay, great. So I'll be presenting work that's being led by Travis Yates and Camille Heylen, who are postdoc and PhD students at Tufts, and it's funded by UNICEF, the Global WASH Cluster in UNICEF. And I'm presenting today because Travis isn't available. So just wanted to state that up front. And I'm presenting on a real-time assessment of WASH coordination in humanitarian emergencies. So to give a bit of a background, there are many different types of humanitarian emergencies. It can be natural disasters, such as earthquakes or floods. There can be outbreaks, such as Ebola or cholera or COVID-19. There can be long-term emergencies, such as droughts or food insecurity. There can be kind of chronic emergencies where there's emergencies overlapping in certain places. For example, an earthquake and cholera concurrently in Haiti, and there can be political emergencies. Each of these emergencies has different WASH needs, water, sanitation, and hygiene needs, that are specific to the emergency. When an emergency happens where the government is not able to manage the emergency entirely themselves, and the UN can be called in to help either with support of the government or in unique situations such as Syria without support of the national government, the UN sets up what's called the cluster system. This is managed by an emergency response coordinator, and there's information management across the clusters. And then depending on the type of emergency, there may be a water, sanitation, and hygiene cluster that would be led by UNICEF. There may be education or food security or protection. These are example clusters. There's 11 here, but not all 11 would necessarily be activated in each emergency, right? And so the cluster system is set up at the global level. For example, for the WASH cluster, UNICEF is the lead agency, and the global WASH cluster is based in Geneva at UNICEF, and then at national levels. And so there'll be WASH clusters activated at national levels, depending on the emergency. They may be activated, they may be transferred to the local government at some point in time, they may be long-term, they may respond to different emergencies over time. The cluster system was started in 2005. Right now it's active in 30 countries in the WASH cluster. And generally the WASH cluster consists of members, of people responding to the emergency. And so generally there's about $300 million of funding that goes through the WASH cluster members. So to get further into who makes up a cluster, Generally, there is cluster staff, which is led by a cluster coordinator in the country and an information manager. So a lead and a lead information person. The cluster staff most often is UNICEF staff, but it can also be, in some contexts, NGO staff or government staff. And then the cluster consists of the staff plus its members. And those members will be international and local NGOs, UN agencies, local government, international donors, kind of anyone who's responding. The idea of the cluster is to bring people together to lead a coordinated response, to prevent gaps, to fill gaps, prevent duplication, transfer funding where needed. The goal is essentially herding cats and keeping, reaching the needs of the affected population as efficiently as possible. So the WASH clusters, which were established in 2005, do a set of activities, tools, and products. They list who's working where in the 4 Ws, who's doing what where. They list gaps, they pull together funding calls. And the idea of the WASH cluster is these activities, tools, or products improve coordination. And the goal is that you would have increased and consistent coverage in the response, and you would have a more effective response. These products would lead to outcomes, right? If you think about this from a monitoring and evaluation perspective, you have activities and inputs that would lead to outputs, outcomes, and impacts. Over the past about 15 years, the cluster has done a number of evaluations themselves within the UN, thinking about what value is the cluster providing. The cluster has never previously systematically, in a kind of publishable manner, reached out to its members to say, what does the cluster do for you? And do the cluster activities, tools, and products lead to or not response outcomes? And right now there's some question at the higher levels of the UN and other institutions about the value of the cluster. And so we were looking at work to see what the cluster members think of what the cluster is providing and how it might help them get to response outcomes. And so first we actually did a review and interviews and key informant interviews, literature review, kind of globally and generally, and that was stage 1 of the project. And we published that. And then second, we actually are going to 3 places where the clusters have been activated. DRC, Democratic Republic of Congo, Yemen, and Cox's Bazar in Bangladesh. These are 3 different types of conflicts. DRC is a chronic conflict, a number of internally displaced persons, cholera, Ebola, plague, COVID, lots of outbreaks. Yemen is a conflict with a number of internally displaced persons, also cholera, malnutrition, and drought. And Cox's Bazar is refugees from Myanmar that are in Cox's Bazar refugee camps with cyclones and flooding on kind of an annual basis. And so we reached out to these 3 contexts, this kind of long-term WASH cluster context with different types of emergencies. And what we did in those contexts is over a period of about 10 months, so from January of this year through October of this year, we're just finalizing data collection now, we have done a series of key informant interviews on a regular basis with cluster members. We've done it 3 times in each context over the course of these 10 months. We've done a series of online surveys 3 times in each context. And then in each context, we've collected from the cluster staff what activities and inputs and what they're doing. Right? And the main questions we're asking in these key informant interviews and these online surveys, and then when we're talking to the cluster staff, is we're asking, what is the cluster activities, tools, and products? What have they done? What are their inputs over these time periods? And within this time period, which we didn't expect to, but now it includes COVID, within this time period, how have those activities, tools, and products helped lead you or not to having response outcomes, right? How has that helped you do things? So we've heard, I'm going to give just a taste of our results. We're literally in the last bit of data collection. We're coding, we're transcribing. And so this is a taste of our results. What are the members of the cluster saying are effective tools, products, and activities? First, the gap analysis, essentially saying, here's the geography, here's the places where the various organizations are working, here's where no one's being reached. That's an incredibly valuable thing to fill gaps. Information sharing. This is about anything from developing a tool or a one-pager on free chlorine residual recommendations in refugee camps, or just kind of these quick tools that go out from the cluster that get put up on the website. Like, this is how we do it here. In Yemen, there's been quite a bit of discussion about should we or should we not do well chlorination. The cluster has made a statement about that. Cluster leadership. One of the things we saw in our previous reviews that the UN has seen in their reviews and that we've seen strongly here is having a strong cluster leader, a strong cluster coordinator and information manager who you can go to as a person and just ask your questions is irreplaceable. Like this, having the strong staff that kind of coordinates, answers your questions is a key to cluster success. And then subclusters, particularly in DRC and Yemen, where conflict or travel is very difficult, having essentially a central cluster managed by a cluster coordinator, and then subclusters throughout the country. DRC has had these for a while. Yemen has just established them, and that's been really helpful at working with local government and working with more local needs and gaps. Some of the barriers to coordination, particularly in Yemen, where there's two governments and there's conflict between those governments. Government and having two governments and who you report to has been a barrier to coordinate. Travel, particularly in DRC and Yemen, where the conflict or the geography makes it difficult to travel, has been a difficulty. Staffing, a strong cluster coordinator and IM manager are key. Often these positions will turn over, or someone will come for 6 months and then there'll be a gap. And this consistent staffing, Yemen uniquely has had one cluster coordinator for 3 years who is very strong, and then another cluster coordinator who came right after and has been there, I think, a year or two, who is also very strong. And that consistent staff is so important, but the staff turnover is a barrier. And then funding, particularly with COVID, there's been funding reallocations, and so there's less funding than has been expected, right? And so there's been funding challenges in some contexts, particularly Yemen. Some of the insights that people have been telling us, we have these quotes, like we ask questions like, what would happen if the cluster wasn't there? And people are like, I have no idea what we do. Like, I can't imagine that scenario because I don't know what we would do without the cluster being there. And so I want to say that the first cut we're hearing from the cluster members is like this quote: we rely on cluster tools not only because they provide guidance in terms of strategies to best respond, but also in terms of geographic priorities, this filling gaps. We literally, when we asked one respondent what would happen if the cluster wasn't there, we got a stream of swear words that I probably can't say on a recorded presentation about what it would be like if there was no cluster. But there are some insights about how to improve the cluster, and people said increasing trainings, technical information would be useful. That relates to improving the website by having more of that information available on the website, making small adjustments to the tools to make them more usable, strengthening the subclusters, particularly in Yemen where it's so difficult to travel. Remote opportunities, there's both drawbacks and opportunities from working remotely due to COVID. The opportunities being you have more people coming together on online platforms, but drawbacks being really that you also have fewer people if they don't have internet access. So it's a hard, like the cluster depends so much on interpersonal communications and bringing people together. Replicating that online can be difficult, but online you can bring more people in. So there's benefits and trade-offs there of the COVID lockdowns. Human resources and having enough people at the cluster to run the cluster consistently would be useful. And then the sense of how does the cluster transition from a humanitarian response coordination to a handover more toward long-term development, and this thought of how do you turn it back over to either the development sector or the government over time, and working on strengthening those pieces. And I will say a lot of this, like the long-term development, human resources, came out in previous reviews we've done or in reviews, but this sense of how much the cluster helps the members has not previously been documented. So the next steps for our work, we're working to revise a theory of change for WASH cluster coordination, to provide evidence to revise global WASH cluster tools and frameworks and ways of working. And in this world where there's currently high-level questions, like literally the question is being asked, what value does the cluster add? And should we just get rid of the cluster system and do something different? Is a question that is on the table at some discussions. We are providing evidence as to the value of the cluster to its members, and then thinking about what could happen next. I will say, I'll read this quote: "We save a lot of resources because of coordination with the cluster." This is a local Yemeni NGO. And then also in kind of the stages of this project, we'd like to continue and work with what's the value of the cluster to the affected population and on quality of response programming. And that's something that we're wanting to work with in collaboration with another project that the cluster is leading, which is a quality project that Oxfam is leading. And so there's kind of, it's thinking about how to document what the cluster is doing, make improvements where needed, and think about how better to reach the affected population is what this work is a larger piece of. So I will stop my share now and come back to the meeting, and I'm happy to take questions.
Thank you so much, Dr. Lantagne. Really appreciate it. We actually only have time for one question since we're on such a tight schedule. But so one question from Colleen Naughton is, how much does the WASH cluster cost to operate?
I wish I could give you an answer, and I can't, and I'm super sorry. I will find that and I will write it in, because it's tough to divide it out by country. You can say Google WASH cluster. Yeah.
That makes sense. There's a bunch of questions in the chat.
I will answer them now. I'm super sorry. I didn't see you buzz in for a minute. Did you buzz in?
Yeah, don't worry.
I'm super, super sorry. Okay, but okay, thank you.
You can use the messaging feature to.
I'll use the messaging feature for all the questions.
Great.
Okay, I think I had my screen on full screen and didn't see anything.
No worries at all.
Okay.
Thanks so much for your presentation. Really appreciate it. Now we're going to move on to our next speaker, Anna Murray from Charity Water.
Thanks so much. Let me just get this going. Okay. So hi, everyone. My name is Anna. I'm the Senior M&E Manager at Charity Water. And I'm going to share some results from our monitoring work related to functionality of rural water points. So I think most people on this call probably know that functionality of rural water points is a known issue. So the current estimates are that 1/4 of hand pumps in sub-Saharan Africa are non-functional at any given time. And that represents millions of people who once had access to improved water points that no longer do. And it also represents substantial lost investment in constructing those. And so there are some large data sets out there, but there are still some gaps in functionality data from some regions around the world, and also for some infrastructure types beyond just hand pumps, where most of the data has been focused. So Charity Water, just to introduce, we are a WASH funder, and we have funded over 50,000 water points since 2006. And so again, we provide the funding, and then partner organizations do the implementation work. And those implementing partners are varied in size and location, and many of them do their own monitoring work. But as of 2016, Charity Water, as the funder of those work, had no comprehensive sustainability information that would be comparable across all of the funded programs. And so the objectives of this work that I'm presenting were to first estimate the functionality rate of the Charity Water funded water points, and second, to look at the factors that are associated with that functionality in order to help inform program improvement going forward. Okay, so introducing the methods here. We have two different data sets that I'll tell you about. The first is what we call post-implementation monitoring, or PIM, you may see throughout the slides. So to date, we have done this with 10 of the programs that Charity Water funds. And this includes a sample of past water points. So we have selected these water points randomly from the Charity Water database. And it includes water points that are at least 1 year old and up to 12 years old. And so teams go out, enumerators locate those selected water points, and then surveys were done with the committee members or community leaders, and then they record observations of the water points as they find them. The second data set included here is what we call an end line, and it's part of an evaluation of a grant. And so the same programs did this, so those same 10 programs. But this time it was a selection of newly constructed water points. So ones that were built within approximately 1 year. And the surveys done and the observations were the same in both of these data sets. And so with these, we did two things. So first, estimated the functionality rate. And we're defining here functional water points as one that has water available. And what we did is we looked at each individual program and weighted on average the historic work to the new work to get the rate for each program, and then combined these together to get an overall functionality rate, considering the relative size of those programs that Charity Water has funded. And so then the second piece here was to determine the factors associated with the functioning water points. And so to do this, we focused on that post-implementation monitoring data, so of the older water points, and used a multiple logistic regression. So the outcome of that regression was whether the water point was functional or not, and then had a variety of input variables. And the inputs were basically based on other research and the available survey responses that we had. All right, so moving on to the results. I'll focus on that PIM data set, so the historic work mostly, and I'll just describe a little bit about the data set. So again, there's 10 programs included here. They're within 9 countries, which are highlighted on the map on the slide. And I do want to stress that they're not nationally representative samples or anything. They are representative of the work that Charity Water has funded with a particular organization. So these programs typically operate in 1, 2, or 3 districts, all in rural areas, but they're not generally within the whole country. So within these programs, we sampled between 70 to about 300 water points. And we also have listed here the different technologies that are implemented by these different programs. And so when we look at the data set overall, we had about 1,200 water points, and the majority were boreholes with hand pumps, but we also see tap stands, protected springs, and protected dug wells with hand pumps as well. Looking at the age of these water points, so it ranged from 1 to 12 years old. And overall, the average age was 3.7 years. So I do want to say that in the grand scheme of things, these are fairly new water points. Most programs, they're on average around 3 years old. And that brings us to the measured functionality for each program. So I'm just going to show all of these numbers graphically on the next slide. So here we can see the range for each program was from a low of 63% to a high of 97%. And if we take just the sample overall of those about 1,200 water points, it was almost 80% of them functioning when the survey was done. Now, if we superimpose the end line results, so this was the ones that were sampled shortly after construction, in most cases, the functionality is the same or higher than the sample of older water points within each program. And the overall average of those end line of those new water points was 94%. And that's about to be expected if it's only been operational for, let's say, 6 months or 1 year. And so when we take all this together, so weighting it by the new to old, and then the different programs based on their size in terms of Charity Water funding, that is, So we estimate that 79% of the water points are functioning. And you can see this weighted estimate is essentially the same as that estimate of the historic work. And that's sort of because we have more historic work, and some of the larger programs are the ones at the kind of bottom end of this spectrum as well. And just to put this in perspective, these 10 programs represent about half of the global water points that Charity Water has funded historically. And so moving on to the second objective, to determine the factors associated with the functioning water points. So this was, again, with that post-implementation monitoring data set and a logistic regression. So we had three main categories of the significant results that popped out of this. First is the water point type. So we found that tap stands were less likely to be functional than boreholes with hand pumps. The second factor was the quantity of other available water points in the community. So water points with, water points in communities with more than 2 available water points had lower odds of being functional. And the third grouping of factors was around the management. So we found that water points that were managed by committees that had savings and those that were, quote, operational, so meaning they're meeting regularly, collect fees, and have maintenance resources, those water points were about twice as likely to be functional when compared to water points managed by committees without those characteristics. So to summarize that, our results suggest that the most sustainable rural technologies are hand pumps managed by well-organized committees where few alternate source options exist. And this, again, is based on data across different implementers in different contexts, but focused in sub-Saharan Africa and South Asia. And so some points of discussion here based on these results. So obviously there's a lot of work to be done to address the issue of functionality of rural water points. Our results are largely consistent with what others have found, and it just continues to highlight what a lot of us already know, which is that this sustaining rural water service is still a challenge. But I think we have a few practical recommendations to derive from this work. So one would be that implementers should consider siting water points in areas of low water point density, because we saw as the quantity increased, that water points were less likely to be functional. The second one is for those that use a community management model to make sure that you keep training those committees, because we saw that as maintenance resources and fee collection was in place, that they were more likely to be functional. Third, funders should consider rehabilitating existing systems over funding new infrastructure. In fact, that was one of the outcomes of this work for Charity Water, as we ended up shifting some of our funding from new to rehabilitated work. And then this is the last point I want to leave you with. So if you've tuned out, come back. So thus far, we've seen lower functionality of tap stands, and with a cross-section of different implementers in different contexts. And we all want to move people towards higher levels of water service in line with the SDGs, and that often means shifting to piped water supplies. And so it's really critical to make sure that the resources are in place to sustain the technologies for piped water supplies, because they're more complicated, both from the technology side and the management structure side. So yes, we want to get to higher levels of service, and that should be the goal, but we also have to keep in mind the idea of maintenance and sustainability. Otherwise, it's not going to serve its purpose for the people who need it most. So I'm happy to take questions. Oops. A few thanks to the survey respondents, the enumerators, the partner organizations, the Water Institute, who actually helped Charity Water set up its monitoring at the very beginning, and the donors. So thank you.
Thanks so much, Anna, for a great presentation. I really enjoyed the pictures too in your presentation, as well as the data. So we have a few questions that came in. We have time to ask a couple of them. So one is just clarifying about water source definition. So someone asked, does tap stand mean that it doesn't have a pump? So is it gravity fed? How does that work?
So for this case, tap stand meant any piped network. So it could be sourced from a borehole, it could be with a pump, it could be sourced from a spring that's gravity fed. So we lumped those all together. And that is actually an important point that within our sample, we had very different types of tap stands. So there were some that were gravity fed from springs, some that were very large systems with pumps, and then some that were very small systems with pumps.
Got it. Okay. Thanks for answering that. We have a flood of questions coming in, by the way, so you'll have fun answering some of these afterwards. But next, could you speak to the type of implementing organization and its relationship with user communities as part of the factors of functionality?
Yes, so the implementing organizations vary widely. So there's some like small local organizations, there's some large multinational large organizations. I would say all of them have close relationships with the communities and are working with the communities in their implementation. Many of these were used management models like the kind of traditional community management model, although some, maybe just one in this data set, was also using like a private operator model at a larger scale. So kind of a public-private partnership, but there are still, even in that case, community members who were interacting with that management system.
Thanks for that. Next question is, do you have some insights as to why Ethiopia showed such a big difference between the functionality at the end line versus the functionality several years out?
Yeah. So that is a very large program that we funded for a long time. And so some of within the post-implementation monitoring, some of the water points were among the oldest ones. And so that might, and it's a very large area and a lot of water points. And I think that is one case where we tend to see some of those actually had also dried up. So it's a dry area. So maybe it wasn't just the breakdowns, but they were considered non-functional because they didn't have water because it was dry. And so some of those aren't able to be brought back on. So I think it's a few different things going on there. And then the new projects or the new water points were, in most cases, the average there was 94%. So in most cases, most of them were functioning. I think it was just one or two cases where we saw it drop a little bit. Not sure if that really answers your question, but.
Well, thank you so much. Unfortunately, we have to move on, but thanks so much for your presentation and for answering all of those questions. And yeah, feel free to kind of respond in the chat or message people individually afterwards.
Yep, I'm happy to do that.
Great. So we're going to move on to our third and final speaker. And we've got Anu Rajasingham from the CDC's Emergency Response and Recovery Branch. And as a reminder to all the people listening, it's a 10-minute presentation followed by 5 minutes of Q&A. So go ahead, Anu. Okay, we can hear you now.
Okay, great. Can you see my screen?
Yes.
Great. Okay. Good afternoon. My name is Anu Rajasingham, and I will be presenting on behalf of my co-authors from the Ministry of Health in Mozambique, the Water Utility FEPAG, the Water Regulatory Body CRA, UNICEF, BHA, and CDC. Cyclone Idai made landfall over Mozambique's city of Beira in Sofala province on March 15, 2019. It is estimated that in Sofala province, over 387,000 persons were affected and that approximately 78,000 internally displaced persons were forced to seek shelter in accommodation centers created by the government and humanitarian partners. The pipe network servicing Beira and Dondo was severely impacted by the cyclone, and water provision was halted for approximately 1 week. This is a cholera endemic area, and an outbreak was declared on March 27th. And by the end of April, there had been over 6,600 cases in Sofala province. The water utility Mozambique, FEPAG, estimates that the pipe network in Beira and Dando provides water for 60% of the population, with over 60,000 connections and 240 community tap stands. Given the damage to the pipe network due to the cyclone, the WASH response included restoring power supply to the water treatment plant, fixing network infrastructure, installing emergency water treatment units, trucking water to accommodation centers, and providing water treatment chemicals. After the cyclone, there were perceptions that the pipe water in Beira was not safe due to the network damage. Routine water quality monitoring of the pipe networks in Beira and Dando stopped immediately following the cyclone. This was concerning as the pipe network was the main source of water in Beira, and there was no information on whether the water was safe to drink during a cholera outbreak. In addition, as part of the cholera response in Beira, household water treatment products were distributed to households in affected areas. However, there was not enough information to know if these distributions should be focused on all households or just those not using piped water. As a result of these concerns, the water regulatory body in Mozambique, CRA, proposed to scale up their water quality monitoring to conduct daily monitoring with support from the Sofala Provincial Health Directorate, or DPS. The CDC and UNICEF supported this effort with the development of a mobile phone-based water quality monitoring and reporting program. The objective of the water quality monitoring program was to ensure that drinking water supplies serving Beira and Dando met the minimum standards during a cholera outbreak, both through the pipe network and at accommodation centers. Free residual chlorine was agreed upon by partners during the emergency to be the primary parameter of interest. CDC created a data collection survey for this activity using ONA, and the form was housed on UNICEF's ONA server. In Beira and Dando, 41 strategic points were included from the pipe network, including near the water treatment plant and before and after distribution centers where chlorine boosting occurred. In addition, points in all open accommodation centers were included. 18 centers were open at the start of the program, and these centers received both trucked water and pipe network water. Data was analyzed and mapped 3 times a week and shared with all National Cholera Task Force members, in addition to the partners involved with this program. After 3 weeks of initial data analysis and mapping in Beira and Dando, CRA and DPS were trained on how to report, map, and share data. Water quality monitoring was summarized both quantitatively and spatially. An example daily figure is presented on this slide. The red points show where free residual chlorine was 0, and the darker green shows where FRC is in the recommended range between 0.5 and 1 milligram per liter. Overall, between May 4th and June 14th, 87% of the 1,080 samples collected from the 41 sampling points in the pipe network in Beira and Dando had detectable free residual chlorine, and 46% of the samples were in the recommended range between 0.5 and 1. The median FRC seen in the pipe network was 0.4 milligrams per liter, and the range was from 0 to 1.9 milligrams per liter. On this slide, the daily FRC levels are shown. The red indicates again where there is no chlorine, and the darker green shows the number of readings in the target range. A larger number of samples with no chlorine were detected over weekends. Weekend dates are shown in blue in this figure. 22% of weekend samples had no chlorine versus 13% of weekday samples. From the accommodation centers, 73% of the 177 samples collected had detectable free residual chlorine, and 39% of the samples were in the recommended range. The median FRC observed in the accommodation centers was 0.3, and the range was from 0 to 1 milligram per liter. The figure on this slide shows the FRC levels seen in accommodation centers by water source type. 131 samples were from water trucks. The quality of water delivered by truck was better and improved over time. 47 samples were from new pipe network connections made in the accommodation centers. FRC from samples at these pipe network points remained low over the 6-week period. These were new pipe water connections, and some were far from distribution centers where chlorine boosting occurred. In total, 26% of pipe water samples had detectable free residual chlorine versus 90% of trucked water samples at the accommodation centers. Almost 1 month after Cyclone Idai, Cyclone Kenneth made landfall in Cabo Delgado province on April 25th. Over 254,000 persons were affected, and over 3,000 IDPs went to accommodation centers. Soon after the cyclone, a cholera outbreak was declared in Pemba on May 2nd. The total number of cases was 6,739. Based on the success of the program in Beira and Dondo, soon after Cyclone Kenneth landed, a similar water quality monitoring program was implemented in Pemba, where FEPAG estimated the pipe network provided 30% of the population its drinking water. In Pemba, 30 points in the pipe network were included at similar locations, near the water treatment plant and before and after chlorine boosting sites. These sampling points are shown in red in the picture on this slide. However, in Pemba, the pipe network only supplied water to specific areas of the city each day, meaning that water was available in different areas of the city depending on the day of the week. Thus, points were monitored when water was reported to be available by FEPAG. On this slide is an example daily report for Pemba. In Pemba, water availability varied by day and often was not available on days when it was supposed to be. In this figure, when water was not available at the time of sampling, there is a red X. Overall in Pemba, between May 30th and June 29th, 64% of the 174 samples collected from the 30 sampling points in the pipe network had detectable free residual chlorine, and 25% of the samples were in the recommended range between 0.5 and 1. The median FRC seen in the pipe network was 0.2, and the range was from 0 to 3 milligrams per liter. So how was all this data used? The emergency water quality monitoring programs allowed for the identification of several trends that helped the WASH response improve chlorination. First, the data identified areas in the pipe network where FRC was consistently low and could be improved with the installation of booster chlorination stations. Second, inconsistent FRC data over time helped FEPAG identify areas with potential line breaks in the network that needed to be rehabilitated. Third, irregularity of FRC levels detected at certain points in the network highlighted issues with the consistency of daily treatment. Staffing over weekends was lower, and data allowed the utility to make changes to staffing. Fourth, the monitoring data documented challenges with maintaining water quality levels from the pipe network at accommodation centers. Fifth, in Pemba, water was often not available at the time of visit in locations where it was scheduled by FEPAG to have water that day, which helped to identify areas that were not receiving sufficient water. Recent systematic reviews of WASH response during cholera outbreaks and emergencies have highlighted that water quality interventions implemented at the centralized level have not been well documented. Our work demonstrates that community-level chlorination and water quality monitoring programs can be rapidly made and set up during an outbreak, allowing for real-time reporting and response. A unique aspect of this response was that lessons learned in Beira were quickly applied in Pemba. This work was the result of productive collaboration between CDC, UNICEF, the WASH cluster, and government partners. These activities could be replicated in response to other emergencies in cholera endemic areas, or a similar, less frequent program could be used for routine water quality monitoring in cholera hotspot areas. Thank you. I would like to acknowledge my co-authors and their organizations, and I can now take questions.
Thanks so much, Anu, for a great presentation. Just waiting to see if anyone wants to add anything to the chat. There we go. What are the chances that this monitoring program can be sustained financially, technically, and managerially by the local authorities responsible for drinking water quality monitoring?
That's a great question. So as I stated, this program was developed to be a daily program, but the idea was that once we got to a point where the levels were consistent, you could then reduce the regularity of it. So we had initially suggested, instead of being daily, let's drop down to 2 days a week. And then eventually, if you're happy with your results, you could drop down to 1 day a week. And we had originally 41 points in the pipe network, but perhaps you could select a lower number of points to make it more sustainable for the number of staff working on this type of programming.
Interesting, thanks. Last chance for people to add questions. Please remember it's in the chat box through Pathable and not on Zoom. Okay, looks like you just covered everything, honestly. Well, thank you for a great presentation, and thank you to all three of our speakers. Really informative presentations. And yeah, I'm really excited to see kind of what the next verbal presentations hold. Just a couple of announcements before we close. First, please visit the virtual exhibit hall. Our sponsors have virtual booths. So much like in the Friday Center, if you were here in person, you would go up to the booths and get a bunch of free pens and t-shirts, whatever it might be. Please do go visit the virtual exhibit hall. That's from 3 to 3:30 p.m. today. And then next, we also have an exciting event for young professionals called Careers in Wash. It's a virtual networking happy hour event. So please be sure to join that today from 3:30 to 4:30 Eastern Daylight Time. And the last poster presentations tomorrow at 3:15, EDT. And then we have a final plenary on Friday that everyone should join as well. So thank you all for joining today, and look forward to seeing you somewhere along the line in the rest of the conference.